And that leads us into ethical dilemma number 2, which is treatment. Are we talking cure, or are we talking being stuck on a sandbar? There are 2 primary roles for medicines. One is cure of disease. So for example, penicillin takes good care of strep throat. Now if you're a surgeon like Marianne, you can also whip it out, but I never had that option. I had to write a prescription. That's the only thing I pulled out was my prescription pad. But the other role for medication is to treat symptoms of a disease when the disease itself is not curable. So in the case of rheumatoid arthritis, aspirin can be very effective at relieving the pain and helping us be a little bit more mobile. It has no impact on the underlying disease. And so this is where the quandary comes in when we're talking about medication. We have many, many, many more medications that treat symptoms, that stabilize diabetes, high blood pressure, myasthenia gravis, seizure disorders. Medications can control the disease, but they don't cure it. We cure very few things. And this is where the problem comes in with medication. Okay. I'm really having a good time with this. Okay. This is an interesting paper that also appeared in the New England Journal in March of 2013. I'm very proud to say that Nick Kozauer, the lead author, was my chief resident when I was training director at Georgetown, and he now works in the FDA and regulation. He notes that we don't really have the ability to monitor the effect of medications. As I showed you, that in some forms, the disease process begins a good 20 years before symptoms manifest. Studies to evaluate medication, either for prevention or treatment, are going to take generations. If you see a study that says there was an improvement over 6 months, the first question you have to ask is, what is the measure of improvement? A lot of the tests that are statistically significant are absolutely meaningless out in the real world. Okay, you can remember 6 objects more after the medication than before, but it doesn't translate into behavior or doesn't translate into improved function. So that it's going to be very hard to design studies. We're not going to get any quick answers because the question is, do we stabilize or do we prevent? We can evaluate a stabilizing treatment in a period of maybe 10 years, but we cannot evaluate preventive treatments, it seems, for what will be less than at least 1 full generation, possibly a little bit longer. So it's a very challenging outlook that we have to be aware of so as not to get sucked into breathless headlines announcing the next big cure. The same thing here. What are the ethics of early evidence? Too often in the New York Times, in the New York Post, a somewhat less reputable paper, in the tabloids, in the news magazines, we see announcements of breakthroughs. But oftentimes these are based on small studies that may or may not have a lot of applicability to what is going on. So the question comes in, what are the journalistic ethics? Shall we say a subset of social ethics, of touting something to sell papers that may not necessarily be quite what it seems to be by reading the quick description of what's going on. It can be absolutely infuriating at times, and in medicine we have examples of that all the time. New breakthrough for this, new breakthrough for that, when in fact it's one small study and may even have some flaws in how the study was done. Can kind of make you crazy. Once again, Stephen Post in his book raises some interesting questions. In terms of treatment, he raised a question that I had never considered, that once you've navigated certain crises of cognitive decline, what happens if a drug can take them back to that point but no better? A modest improvement or stabilization of the decline will be viewed as gratifying by some, but not by all. And finally, the improvement on the cognitive scales that are in universal use to evaluate any therapeutic modalities may have absolutely no translation into function within what is otherwise the real world. And this is a very important thing to look at, because a breakthrough is only meaningful when it improves the situation for the patient, the caretaker, the family, the society, all of the above, or at least some of the above.